feel free to do that, because the more resources and the more support it's just going to make them more successful in the end. So be your child's advocate. You can't advocate. It means that support or be there for them. Don't say, oh, teacher, no, or nimde or kikano. Be careful when you say that, because once a teacher for they are with your children more hours in school than when they are home. And see, sometimes personality traits, different things, behavioral traits that maybe you as the parents, because by the time you already tired. And see, certain things are one observe, but the teacher sees it. And see, if the teacher is telling you, say, or suspect it's a BB, some disorder or some disability, don't be offended. Look into it. It's not going to slow your child down. It's not going to label your child. Now that you are looking into it and trying to intervene, a bit increase the chance I will also be successful. Become the expert. Share bisa questions. Ebia or go through the same thing. Bisano, what did you do with your child? I know says sometimes, family business there, we don't want to expose weakness, but sometimes, there's something that is there that you didn't know. So it's really important that you are open and that you research yourself and look into what resources is there. And then focus on Ubano's strength. Don't focus on their own focus on what they really do well in. Hey, about cleaning the focus on that. That self-esteem that you're giving your child is what's going to allow them to be more open when it comes to learning. But we have to say, in their minds, they think that is true. And this connection, that was supposed to occur when it comes to learning, and connected, because what can say and see, why should they even worry about building a connection there? And see, you want to support your child. You want to emphasize what they're good at. And then your influence is what's important. Meaning, say, once a teacher is parents way there, or you're very involved, when we say any resource, any new developments that they are coming to you first, because they know you are on top of your children, you are on top of things. And see, that is the type of mentality, and I said the type of behavior that we should have as parents. We should always be involved. So let's go into other disabilities or illnesses. Attention deficit hyperactivity disorder, ADHD. I'm sure that we've heard of SATM. Anxiety, yes, in Kolano, anxiety. I know that sometimes when it comes to mental illness overall, Ghana there was some type of stigma. And I don't even think that it's just Ghanaians. I think that generally, nobody wants to say Omobano was some type of mental illness. We cry if you are a child and you go and tell your mom, said, Ma, I think that me are depressed. And I said, Ma, I think that I have anxiety. The way Obesha will not cry, you wish that you never said that. And see, the point is we have to be open, because sometimes there can be things going on in the home that can be triggering certain mental illnesses, because a lot of these conditions, sometimes is based or triggered off of environmental factors. But let's talk about attention deficit. Attention deficit is a developmental disorder that involves delays in how well a person is able to control or regulate his or her own attention, behavior, and emotion. What does this mean? The ability for you to control behavior, your classroom, now there you can't control yourself. I can't control now was sorry or come back and forth or kasa by heart on seeming control, and yes, but that ability to control, that neural connection has not been connected. There has been some type of imbalance, some type of something that is wrong that is contributing to that. And believe it or not, there was some adults or in pennyfoso, they have this condition that was not diagnosed from childhood. Now, if I say ADHD, ABA, Ubano or ADHD, it doesn't mean that we have to start treating them with medications. That's not what it means. What it means is that we have to start implementing things into their lifestyle to help change the way they behave. And we'll talk a little bit about that. But ADHD, there were different types. There were inattentive type, there were hyperactive or impulsive type, and then we have combined type, meaning or both. You can pay attention, and then on top of that, and see again in the classroom. So you're inattentive, you're unable to sit down for maybe let's say it's a teacher or a lecture, depending on the age, because age be the amount of time I will bet me at baby. Once a 2-year-old, you can expect that or bet for 30 minutes. Now or if they are doing that, that's actually a sign of something else. Okay, and see, and you're normal. But somebody that would do maybe at 10, 15, we expect that at least 30 minutes to an hour there, you should be able to sit still and you should be able to pay attention. And so well, even within yourself, when you are 30s, 40s, whatever age, but one will say, I have that problem. A bad lecture, and I say, even say, yeah, sorry, pastor and all preaching means to me and pay attention to what they are saying. Within 5 minutes, now I get distracted. Those are signs that there can be some inattentive ADHD happening. But keep in mind that it's not something that's just only occurring in school or maybe in church. It has to occur in more than 2 places. So for example, it has to happen at school and at home. Behavior is going on in both places. If it's just at school, then it can be say a topic wasn't interesting to the child, or the information that is being given to the child, maybe advance it from the normal trend or classroom. And see, sometimes in a situation like that, that child is actually tested to find out that you're not supposed to be in this class, you're supposed to be in another class. And it can go the opposite. Lecture you're too advanced, lesson schoolwork you're too advanced, just so that they can be able to pay attention. And so these are things, this is an inattentive type of ADHD. And then hyperactivity, impulsive. Again, on means nafako. No kasana or the nesa touchy near or call back and forth on mean when input, it's just like too much activity. As I say, the motor like it's just go on means nafaku or kasa too much by heart. No, can't just talking. Teacher no be sat classroom BB, I'll say raise your hand or no or bet can't answer no, whether it's wrong or right. These are signs of hyperactivity and impulsivity. These are signs that they have ADHD. And then obviously you can have both. There is no blood test that bets me are diagnosed with ADHD. And I any imaging and I say X-ray or CAT scan that no or ADHD. It's really just a clinical diagnosis. The behavior no whether was a diagnosis. And so when it comes to building that diagnosis, monitor observe and see what they are doing at home. Now teacher also observe closely. Now I exchange information or say, yes, I've noticed that even TV crowd, TV on means or record back and left and right. And then the teacher will also say, yes, I've noticed that say be a quiet hour, no, or making rounds. Those are signs that, yes, this child has ADHD. And what can cause it? What can give ADHD? Often, a genetic. Unfortunately, sometimes, it be our parents, all parents, they didn't diagnose you as a child, especially your tete or Ghana or school or Ghana. Nobody's testing you for ADHD. ADHD in the crown, who knows about that? That's not something. They will just label you, say, we are crabon. Meanwhile, you have this this learning disorder, and I said this disability that is on you. That if we gave you some resources, we gave you some behavioral techniques, and no better me as well. And then other risks is it can cause during pregnancy, it can cause problems for the child, and also stress. So and you are having stress, that can really impact the child. It can actually increase the risk for the development of ADHD. So it's really important that you're watching these things. Can you grow out of ADHD? Yes, you can. It actually can change over time. One says sometimes certain behavior traits it's just based on maturity level. They are not mature. They don't know, say, a back classroom and I say, sorry, them why. You have to calm down. You have to sit still and you have to pay attention. No child at the age of 2, 3 understands that. Sometimes as you are getting older, say, no, I'm supposed to sit down. For some people, start understanding, and your mind, and see that is a delayed effect. And so there are certain things that we have to teach them. We have to show them, say, try to give yourself 5 minutes and listen intensely, and then give yourself a break. Because at the end of the day, I control, but it is a learned behavior that they can work with. Other treatments is medication. I know that parents, they don't like to give their child medication for that. And I agree. I don't think that medication should be our first impulse or first initial treatment. We should consider, again, the behavioral modifications. And there has been studies that show that diet no so count. Ebi ubano umano esichirejane too much. Chips, ni cookies, ni candy, ni ice cream. Now that is their main food. It's okay, say once in a while, not one, those type of things. But if that is all you are giving that child, McDonald's, fast food, if that is your main source of, or the main food that, they're gonna behave in a way that's normal like the rest of the children, because they're not receiving the vitamins that they're supposed to receive from the healthy foods to help build those neural connections. And so very important, there has been studies where parents have eliminated sugar from their child's diet, and they've seen significant improvement, especially in the hyperactive form of ADHD. And see, that is something to look into. And see, moving forward, autism disorder. What is autism disorder? Autism disorder is a developmental disorder that affects communication and behavior. And it can occur in all ethnicities, all races, all economic statuses. So meaning that there is there's certain behavior that or display that is not normal, and also the ability to express themselves as a off kakra. So for example, I think that earlier, I was saying the age of 2 or 3, and you are talking to them, sometimes on more attention span, it shouldn't last any more than 5 to 10 minutes at that age. But if you find that this child can sit there and just stare at you for 30 minutes, 40 minutes, and they're just sitting there looking at you, there's a problem there. There's some autism possibly occurring. And so you have to look into it. And it is important that we intervene very early. Now, what is the cause of autism? Autism, sometimes maybe there's another child that or they have that in the family. So maybe that is why your child developed this condition. Or you decided or something like that, older parents, that can, because especially the mother, if you are older person having babies, and I know sometimes you can your child is at risk for autism. And this is not saying that just because when you need we decided so we'll get you pregnant, that doesn't mean so autism, but that risk is there. And that's why from the age of 35 they consider that to be an older age for pregnancy. And so in that stage, on by a certain genetic test to make sure that on pass any disorders to say Down syndrome, Fragile X, and all these other conditions that, unfortunately, eggs, the genes, the war eggs, and sometimes passing it on to the child, it can cause for some disorders. So what are the signs? So I will talk a little bit more because autism is such a broad area. Sometimes it can be missed, especially early in a child's life. And there are different levels to autism. There can be autistic children that they seem somewhat normal, they do things normal, but there are certain things that's a little off. And then there's autism that's very advanced, severely advanced, that omicron, just say they almost a home because they are unable to function normally. But one of the main signs or the age that you want to really look, or the age that we as physicians look for signs is age 2 and 3. We start asking parents certain things, certain milestones. Does your child do this? Does your child do this? Because those questions, bear expose whether the child has this condition. They're looking somewhere. Meanwhile, so you've been saying his name for over 2 years. Your child should be able to pick up their name by 6 months. They should be able to recognize that this is my name. They should move their head and look towards you. If they're not doing that by age 2, that's a real big concern that there may be some autism going on. Weird facial expressions. We don't know what they're doing. That can be a sign of autism. Also, inappropriate emotions. Maybe something bad has happened in the household, everyone is sad about it, not or no, so that is off. There's something going on that we need to look into. Maybe autism, it could be a different mental condition, but that means, all it means is you have to intervene. You have to involve the child's pediatrician to look into it. And then one of the more common signs is sensitivity to light or to noise or to temperature or to different textures. So for example, maybe and then your child is like, oh, I can't take it, turn it off, turn it off. That is a concerning, especially if it's something that is happening all the time. Maybe once in a while, they want you to turn your music down, that's different. But if it seems that you're very sensitive, they start crying, they start acting up because sound noise, disturbable. That is a sign that there could be some autism going on. So what is the treatment? Treatment involves a whole host of people are specialists in this area. If there's a speech delay involved, you want to involve speech therapists. If their ability to write or to pick up a spoon and feed themselves is involved, you want to involve occupational therapists. Meaning that you just want to intervene. Ask your doctor, what should I do to help this child? And they will arrange and give you all the resources that you need. And see, the mistake that Ube said, ignore certain behavioral traits, because the longer you wait, the more that behavior is going to become permanent, and you do not want that. Okay, and see, let's move on to childhood anxiety and depression. Like I said, some of them can have anxiety and depression, and we need to be open to that. Anxiety can present as excessive or uncontrollable worry. They shouldn't worry about anything. All they really should be worrying about is going to school and getting their schoolwork done. That's their job. But if they're worrying about mommy or my or when it be a BBSC, that kind of thinking, that's not normal for a child. That is a sign of there's some anxiety going on. And sometimes they may not express that behavior, but they show signs of headache. A child shouldn't have headache. or migraines. Sometimes when I receive pediatric patients and they have symptoms like headache or restlessness or maybe heart to me beat fast and hard, anxiety is something that I have to rule out. I have to look into the possibility that anxiety is going on. And often anxiety is triggered by our environment. There's things going on in the home that and see, because of that, we develop these type of symptoms. It's very important to take note of that. And again, like I said in the beginning, as a parent or decision making, choices that you make does not only affect you, it affects the whole family unit. And so when you say, oh, yet something that is wrong, why worry come up, but you feel so person or baby, and also person be a be different. That is going to affect the child. Maybe who wouldn't say, oh, the child doesn't know. It's just they're quiet. They are watching, but they're not saying anything. And because they are holding it in, not a causal anxiety or not a causal depression. Oh, yeah, baby, that is wrong. Boldly wrong. You think, say, oh, yes, you think nobody sees. Umano, they see, but they're not saying anything. But because of that, now what trigger anxiety and depression into that person? It's very important that as family, as parents, you have to take that position seriously because you're not only affecting yourself, you are affecting your child. Depression is the same thing. Basically what it is, and it's severe symptoms that affect how you feel, think, and handle daily activities. If you notice that Ubano or Timiga the whole day, just they are always sleeping. It's not because they're lazy. There can be possibly that there can be some depressed mood going on, or they can be the opposite, where they don't sleep about 1, 2, 3 a.m. So they're up going still. That's a sign that something could be going on. And see, you have to communicate and talk to your child and find out what is going on. Other signs can be, say, all of a sudden, before Nana or Kasakama, or you're very friendly, very happy, such a joy to be around. But now all of a sudden, quick to anger, always annoyed, all the time as a bibi hano, all the time as a bibi anything. That is not the usual behavior for your child, and all of a sudden they've switched and become that way. You have to sit down with your child and talk to them. And sometimes, you talking to your child, and more because they don't feel comfortable exposing that to you. It is very normal. And see, don't feel or don't be afraid to involve somebody that is a professional. And I have to emphasize be a professional because you don't want, say, some random person, or maybe, and not to say, that person doesn't know what they're talking about, but certain conditions, you're very sensitive. And see, if you don't go about it the right way, you can make things worse. So you want to make sure that whoever you are involving to help your child, or you'll be our own condition or some type of experience or some type of knowledge in that area, because all of a sudden the grades, before you're A student, after you're a C and D student, what's going on? And I say all of a sudden school for no fre or more trial letter, and I saw more fre say, and then ubano wa school was skip class. These are all signs that something could be going on. It does not mean, or it doesn't always have to be, say, anxiety or depression, but this is a sign for you as the parent to involve yourself and figure out what's going on. So again, it is important to talk to your child. It is important to involve the professionals, the doctors, the teachers, everybody. You need to communicate with them so that you can support your child. And sometimes you can treat these conditions with mindfulness and meditation. Now, mindfulness and meditation, I'm not saying anything against against SDA, and like our teachings, because it is actually a part of our teachings, meditation. If you don't read your Bible, or if you don't read anything that has any type of spiritual influence from God, the things that are in your brain or the things that will feed you is all negative. You want to feed your mind with positive things. If you're feeling anxious, and because it's not just children that can have anxiety and depression, as we already know. But you have anxiety or you have depression, sometimes you have to stop, take your time and breathe. Take a deep breath. Try to remove the negative thinking and think on positive things. Think on good things. Think about the many blessings that God has given you. Put your mind more on that. And Jai said, oh, focus on where I am mistake, where no. Focus on positive, because the more you focus on positive, the more those positive connections in your brain will be built. It will be connecting, it will grow. But all the time you are focusing on negative. The old TV, you're negative. The old phone, you're negative. Just be negative. That's what's going to be connecting in your brain, just negative connections. And see, about Anyama said, like, if we're doing something positive, what the negative, because that is what you know. That is what you filled your mind. So it's really important, say, fill it with positive things. And the way to do that is to actually read the Bible, actually read and put those things into your head, because that is what's going to come out. You want to ask God to create in you a new heart, okay? Because that is what's going to help. In Ezekiel chapter 36, verse 26 and 27, I'll say, a new heart also will I give you. A new spirit will I put within you, and I will take away the stony hearts. I will take away the bad thinking. I will take away the bad thoughts. I will take away the bad behavior. I will take away the delay, speech delay, ADHD. I will take it out of your flesh, and I will give you a heart of flesh, and I will put my spirits within you and cause you to walk in my statutes, and you will keep my judgments and do them. And so if we keep this promise and no bebway, and see, this is my conclusion. If you didn't hear anything, I want you to hear, say, you have to be involved. Whether you are living in the same house with your children or not, you want to make sure that also involved. You're also involved. You know where they're going. You know where they're coming. You want to also arrange family events, just you and your family. Moon co-vacation, moon together, because that's what makes the family unit strong. Nobody will be able to come in and destroy the family if you build a strong foundation. And talk about your problems together. Make time to ask your child, what happened today in school? Remember Bob? What happened to Bob? Involve yourself. Act like, oh, you're interested. But so we all want to say like, oh, I don't care about Omuna Fufo. I don't care about what's going on. And yeah, Omuna Fufo no never try how to go about life. And that is a fact. And so you want to make sure that your presence is known. And you want to make sure that school is their top priority. There's time for everything. But you want them to know that school is what is going to help them build the foundation that they need to do whatever it is that they want to do in life. And see, Manoasi, I don't know, say, well, enough time for question and answer, but if so, any asembisa, not just a contribution, because I'm sure, say, some people are almost very knowledgeable, or and that's almost experts in this field, social workers, nurses, speech therapists, all those people. So added BB, this would be a good time to add to this lecture. That's it.
It was Dr. Owusu. It was our decision is a very interesting part. The particular way I read me first so na boy man and can't the way almost be a thinking and the way almost be mafa. I mean that. You for the everyday a makwan na yeni ya war asembisa, especially any wasembisa no itimi ebisa. Umio two one.
Also, they also.
Pacho opinion also.
Okay. Priscilla, that's na say me follow where in the pa na me wo question bi efa a speech delay no on say all kasa no o ka say akra ni nya be at least free base 6 months call and say 1 year na e was simple e bi to say mama dada ni ade no otimi ka okay assume say akra no or you be 2 years plus na otimi kasa oye bibi a wo kasa jai a otimi ho say we jai na mum ne kasa wo ka no enye kasa emini hwe
Yeah.
enmini hwe enimi enti no na ontimi nka mama eni dada eni ade no eno no onso na wo kan bibi say basa wo say consult the teachers ni ade boyinso at this stage no so no onyanko school enye hwe enti time be na wo say wo suspect say akra na ebia or was speech delay na ema no call so sa he say e bia nka bae na no de was nkutimi kan bibi and follow up yen ne say akra no say wo TV programs bibiri bi wo a ekirikiri wo mu no ma no mebi koko melon ne hwa ekirikiri wo mu no na no mpese mi hu say eno no eboa good for the kids na say enye good for them. Say TV program no and on improve almost speech, you know, and I say improve. Me do I say. So what question I say?
Yes, question is only a very, very good question. First, I think that ABI may make a mistake. At the age of 10 months a day, except by then, from 10 months going, ABI ain't happen at 10 months, but from 10 months going, there, Colano, or started come mama dada or started a try say or become baby see that's a 6 months because 6 months no started kasa that's good but say on young kasa it doesn't mean say there's something wrong but from at least 10 months going there that is the time where you should start to see some speech development and at that age so you're right most often in Kolano mutifie or munko daycare or any type of setting that involves a teacher. And see, in that regard, you want to intervene as soon as you suspect something, even if it's nothing, you are worried. And so they just let your doctor, the pediatrician, a client doctor, Manu who said, I'm suspecting, say, there's a speech delay. Dr. Anubetro said, you know what, no, you're monitor because, or you're young. And I said, yes, at this point, they said, or can't certain things. And see, my doctor, I don't know what direction to go. Your job is, if you suspect that something is wrong, especially if you are seeing, say, other children, only at the same age, but they're doing and saying things. And there's always one or two that be advanced. You can't use them as a reference point because you're different. But yeah, average. The average behavior so we pay attention to if ubano or active and I say according to that average behavior so ubano or your difference you want to pay attention to that and see I think that is the time as long as you suspect something you should allow you should involve the doctor. And a second part part of the question.
Second part, me say I saw a TV programs.
Yeah, those TV programs, if it is an actual educational program, it is actually helpful because I've noticed that a lot of teachers use, and yet actual TV programs, maybe a YouTube clip, maybe a 3 or 5 minute video, not maybe a more ABCs, no more the music be I can't say they are me as or more ABCs, or they even have videos where it's like how to pronounce certain words. I know they're very good, but other TV programs like cartoons and things that say even you yourself, one who said then don't waste your time to allow the child to sit there for many hours or whatever to pay attention to that. You want to make sure that whatever they are watching, a educational video, and normally, depending on the age, those videos, a short video, and yet video 10, because they know say the attention span. So you want to make sure that, or you can even consult a teacher or the doctor and say, what do you think about this video? Because we know of certain videos that are very helpful, and we know of certain videos that is just a waste of your child's time. And see, the point is open and be communicative. Talk to your doctors, be free. Other parents, they be at the same age. Also ask them questions, because you never know, it be almost BB that will be able to help you. Yeah, I hope that my answer question.
Doctor, let me start question. Let me start question. Number one, stamina. Say, obia or kasa or rosuno. A connection you brain, man. I say no. Genetics. I say again. Second one, no anger and kasa. Say for what causes that anxiety?
Very good question. See, first part, no stamina, no more. I say stada, and I say kasa, na say roso. That is actually a form of a speech deficit, a speech disorder. And if you catch that early, that stuttering and that's stamina, that can go away. Once you're president of Krano, no was disorder, Kasana said, but he was able to receive the resources to be able to correct Sometimes it can be genetic. Sometimes it's somebody in the family, they had that. Sometimes it can be an environmental trigger, something the mother did while she was pregnant. We haven't been really able to pinpoint, but these are all factors that can contribute to being a stutterer. And see, again, the point is early intervention. Send him or her to their doctor and find out what you can do to help them, because these are things that will see me resolve with time. And see, by the time we do a certain age, not sad disability and sad disorder, a free her, it's not a problem. So that is very good. And opening now, second question. No, say
anger. Behavior.
So you will be surprised that sometimes anger can be something due to some type of disorder. It can be a sign of autism. It can be a sign of attention deficit, ADHD. It can be a sign of depression or even anxiety. And yet normal say any little thing now acting crazy. Get to the roots of what's going on. Once everything is calmed down, now I should I excuse you and your child and talk to them. What's going on? I don't know. Why was that behavior triggered? Why did you do that? Find out what's going on, because sometimes it can be they're seeing something that they're mad about, but especially as Ghanaian parents, sometimes parents not yet so open. I think this generation very different, but parents now and how you feel. Your feelings don't matter. That was the mentality. But maybe I'm thinking that maybe age group, maybe a approach, be a little different, because we've seen that you have to allow for your child to express themselves, because what can happen is that they will hold it in, and then any little thing that might explode. And because of that behavior, they will use that same way of reacting into adulthood. And see, something that here say because you weren't given the skills and the resources from young as to how to control yourself, as to how to express yourself. You weren't allowed to express yourself. And see, sometimes that type of behavior can be due to environmental triggers, or it can be a sign of some type of condition that's going on. Especially young boys, there's some attention deficit going on. And see, like in classroom, math, now start a fight for no reason. It's not that we're bad people, but there could be something going on that requires intervention. And so again, it is our responsibility as parents to look into that, to figure out, why are you behaving like that? Because we are not like that. Why are you doing that? And then hopefully, and know what is going on so that you'll be able to correct our behavior.
Doctor, our question is that one person.
Hello,
Boss, mommy. Yeah, a question about chat. No, we are not your mommy Mary. So, you program between you. Question was it, is it true that boys develop at a slower rate than girls?
So that is something that has been put out there. Say girls mature faster than girls, but I mean than boys. But it depends on the area. There are certain things that naturally, we tend to be able to get that connection early in life, whereas in boys, it's not the same. And sometimes it's not saying that one matured faster, it's just behavioral. For example, boys tend to be more active, more hyper, more physically moving, whereas as a female, is within us a natural characteristic saying Shada and Tissa. Most young girls are not like that. They're more calm, they're more able to calm themselves, regulate their behavior. Whereas boys sometimes they can be impulsive and they can behave a little hyper. But it doesn't mean say we are mature faster than we. It just means that that connection, hasn't been put together, and it's also a trait of boys and girls. It also shows you, when you look at boys and you look at girls, there's some behaviors that you're expecting in boys and some behaviors you're expecting in girls. And my dear, they play with dolls and they play with things, house homemaking type things. And then remember they cars, fast. Those are just personality traits. It doesn't mean that mature or that there's some type of disability or disorder. It's just a personality trait.
That's Aunt Mary with Makasa.
Your doctor does. I'm now cancer and cry young woman, Yana, problem. Once a man on this time school in Chiliana. Our dear no buana kechika cranty or munica crap. The Besser said. Sebasana say I wouldn't say moon, you are able of why I say the man December young Corano, where the now you see, you almost so now.
Very good question. That is why vitamins, here, prenatal vitamins, especially your prenatal vitamin, the mattress to DHA, that is the vitamin that will take you. The mattress of DHA, because that DHA, it is a type of enzyme or omega fatty acid that is given to the baby. So they bet me build it a colonadrin in the spinal cord, because spinal cord, nerves, that any spinal cord, and no nebema, nisano, ayejman, nano, all those things. That is what builds a strong foundation. Foundation of every human is their brain and their spinal cord. That foundation, if it's not built correctly, it causes big problems. And see, that is why a lot of doctors emphasize vitamins, take vitamins. Don't take vitamins, make sure say a healthy. Sometimes as a pregnant woman, you have your friend of cravings, or some different tastes to be, me pizza or me ice cream. Those are good, okay, fine, you can have that. But making sure say you're also eating healthy foods that will help build that child, because what you're eating, that is what's building the baby. That is what's forming some connections in that child's brain. And so very important say the obedience, no matter what age. And even say why you watching say okay, what you 40, age 40, I think now person will build it with family and that's all creative family. That doesn't mean say because when it doesn't mean say automatically no, it just means say risk will not I increase. And see, because of that, you want to make sure say over setting Niama in place to reduce that risk. Diet, be more healthy. Ube making sure say vitamins you take it seriously, religiously. So those are things that you want to keep in mind.
Dr. Mpacho, what do you sorry, DH, you know, if you have a say, Kenya 4 million, Nanaka, and Bana Organa, and I can't no money theater.
DHA, you know, they always write it as DHA. Very rare say on betro the whole name because DHA, you know, Edina are very long and a pronunciation, you know, Korano, so yeah, very difficult. Docosa hexo BB is a omega-3 fatty acid and no so when you any vitamin on betro DHA, so that is what you are looking for, DHA.
Yeah, that's
and that's it.
So Dr. Mamembo Haka say, oh yeah, Ghana so yeah, inyano ma na ye ma no enyim no. Omo so no ye wo enura ye de ema wo vitamins here bia. It is a baby wo Ghana, na se nwbo Ghana wonyima. Also se ni nkran no num se no. Ghana ya na omo nye comparison enu na talk kra. Intien so mu nkran ye nya de sua ye nse omo so den. Na enura hodo na de mom vitamins no ai de mom no on betimi anom ne ye na omo so enwo nkofa ohaw bia na se bia enkofa de kan bi so de emma letimi aboa ye nyina Dr. Medase na mo kwesi bia pese mi busa na wo tradition na wo bo nyane bi so bi se sugary food no bi so a entimi emwa ma nkwara na adwene na betimi akofa language deficit ya ka ho asem bi aba na esa wo nyane bi so a enkwari di a eboa omo build omo adwene with regard to language ana ebi sa ho abutia gbo bi so sa atre na etimi e dia afa ye manu nuane etimi so no aboa.
You know, I don't think there's any specific food. Maybe maybe nutritionists for and as a dietitian for maybe on back can be different because they focus more on food, but I don't think there's any specific food that boas speech. However, no, the more healthy your food is, the more natural vitamins you'll have that will help build certain connections in your brain. See, you want to make sure that even down to the formula, you want to make sure that whatever formula that Oma Colano, a formula, a bit boa colano, a bit building a colano nadreno, because they're very important. If you notice some formulas now, Omatron brain development, because Oma who said that is really important. Whatever you are feeding the child, that is what's building that child's brain. And see, for example, similar, I think it's similar like now, Omatron a brain development. Nti oma added extra vitamins, DHA, no, oma added account to make sure say be as a mama no one take it DHA, no, and as I say be on the diet, no, it wasn't that good. At least within formula no dear, a bebwa. So you don't want to use formula, you want to use just a breast milk. That is also fine. Actually, that's the best thing that you can do. However, the diet, then you might as well give your child formula, because breast milk is a reflection of what you are eating. And so diet is poor, you are just giving a poor diet to your baby. Even though body but try a condense it to give the vitamins. If your diet overall is not healthy, it's hard for the body to give the amount of vitamins that's needed for proper child development. And proper child development, and you're just speech, the way Ombe Nancy, the way Ombe uses critical thinking. There's so many levels to it. And see, diet no dear, just try to make sure that overall no dear very healthy.
Doctor, me a question and anka me 6 cents bemwa. And I'm so attached on and until me fact it will be musa and count.
Okay.
Almost 1 year what all can say sugar food na was here for man cran and emma development, as yeni medical be the sugary yini the be one say be say ice cream no normal cake yinuma ye dear si try na enuane so amefa ne say contain sugar but indirectly no mudia sugar ewumu no so no ho asem ben no so oka if say be all man raw sugar be ni but nenuanu bi nso wo ho a say be a board any a bank queen when you know dear a coffee sugar some eba and no so back on say.
No, I know you're different. Set me can't sugar that to say the all kind ice cream, candy, cookies, processed foods. Natural sugar there is good, it's fine. And aduane breaking it down or sugar. And see, sugar no, if you think about it, our brain feeds on sugar, glucose. Yeah, penny for a mom module age 65 and going, or even maybe 70s, 80s, you know. So, or diabetes, the cutoff for diabetes, you know, we increase it. Why? Because you mean that body, you know, energy, sugar, no? And so we don't want your sugar to go too low because naturally, you know, here a certain amount of sugar. And see, at the same time, no, the type of sugar that you're giving your child is here. Ice cream, sugar, all those things, you know, all the time. So that is your main meal every day. That is what your child is eating. Don't be surprised because that sugar is making the child hyper. Don't be surprised on Timi and pay attention. Don't be surprised on Timi grasp niema fast because sugar no and no control body, you know. So you want to limit it. Natural sugar to say about DNA, those type of things, that type of starch, you know, there, that is fine. That's okay. But I'm talking about processed sugar, those type of sugars that we all know, say, and that is the type of sugar I'm talking about.
Yo, yeah, that made us a doctor.
Yo, the moon nurse things say, yeah, Breno, echo about 9 upon Sima Edu. Now, this is be any question what they are, then can addition nanka idi ABC. So the beya, a bit me akodanya ahoden, na so here my na ochina so no yetimi aba na yabeto aso. Say pastor, Mr. Pastor so. The pastor will touch be a person or can and so my announcement that coach na program no asem ada doctor so no ase.
Yo, Bajo, so mami so busa question timba and moment no.
Yo.
Bajo, doctor, me question is say now can say unya na se onyema aya na mpempe no oba no etai affect no. Me say which me say if you be na would kwa my pregnancy difficult and I said to me affect akwala no but my question no.
According to medical terms, you know, from age 35 going, we consider you high risk. So high risk, you know, it doesn't necessarily mean that by all means obenya some type of effect. No. What it means, let's say, at least for doctors, you know, is that we want to make sure, say, you better test it, and maybe I'm making sure, say, that risk for any type of disorder, you know, you better catch it. Also, you know, at that stage, you know, at that point, you know, eggs, you know, I said, at that stage, you know, it has gotten to the point, say, and see, before that, in your 20s, when your eggs were fresh, and the genes and DNA that are creating akolano, that stage, you know, trim. And so it's really likely, and I said there's more of an increased risk. Doesn't mean that that's what's going to happen, but risk, you know, I increase. He said some of the connections that can occur, and happen. The connections that should happen during developmental or that conceptual part stage, you know. Sometimes, you know, it doesn't occur, and it doesn't occur in a way and I say normal and everything will happen normal. But I don't want to give that message, say, oh, my Drew 35, and see that means say me bano or baby, no, because I was 39, 38 when I had my last born. And see, and there's nothing wrong with him, at least as for now, there's nothing wrong with him. So, but what I'm saying is that risk, you know, is there. There's an increased risk. And so for that reason, you know, doctors, you know, been making sure say on certain tests, certain exams to make sure say be healthy. And because that risk is there, you want to make sure that diet, be very, very healthy, because you want to eliminate any chance that a colonoscopy are abnormal. I hope that my answer question.
So, Dr. Priscilla, I'm saying now we are in for some rare treats. We are great to I am a minimum of BBC and Yami boy ABCD, Yehu Yedi, Yamination. Na okay, can I be say, hey, because a been more or more frono, basic food, crano, omunyano, omueti, and sacrana, neaba, inti. Yeah, that was it. Say, pay attention, dear, a boy, a boy. Parents in moment, doctor for ye, because you call on the condition be a okay, ya, your brom, your bomb, which dear, your domium, your diomatem, and so then Yakodano. You who are sorry, you who fear, you who baby, and your bomb, which dear, near diomatem, and tearable, near my case, now your west. Now, Kodani, dear Nina affecting. And then the doctor for me in the say, oh, problem be a who are Kodano, cause specialist for Fanoko. Now, one yes, oh, better if you now because I call a bonnie, now Bruno Ma, now Bonnie Chedi, now Domino. And more. Africa for no. Ya higher more frabby brain tea, ye are not affecting. Near an anum dear firm, we are yano, and moving near the ma. Oh, Wakodakra, Kobo Ball, Article, Koniwa, over crocro, ever crocronona, ya Helenia Tunufono. Na Untiminka, na or the Abedana, na Juno Titi, Muna, Yamane, bro. Usia we are crown over catcher, mammy said, Missia me ya. Oh, mammy, Bill, compassion, aboa. I don't know, see we are, what could it of it? Near bro. Intimacy, my parent, Mama in Tini, and and got a minimum silver sign. I'm my presentation on quality and I quality in Umrea.
I think that you're in Coladia.
Their time into you, Dafofro. Yo, maybe Mr. Danso.
Pastor, that was it.
Yes.
For a series, and crying, but Saturday, a coin your honor, and my any Musa question, with me, the questions about, and actually, so and say, yen say, Pia, a day and cry home so additional, and so ever. Now, my in has 16 bar lie, so now me da Dr. Owusu-Frimpong, and so I say, which say, neighbor, now, Otimba lie, so no, my addition to say. The here pan say, nyina no ye de bedi dwuma so de be ye beboae na ye ma ye wo mo en ka even kwa ye nananom aye no mutifie no ye betimi enso no e de abo wo mo na omo so no etimi enyi kwampa so e daache no omo so no bra asi wonye adisho se de anim no ye na otwe mu nyina na ye no nyambo a wochina de aduru so no ye ani ho asem ne ye beka behwe ekwan a bufa so abo woni ho ban ene even yen so enya any yare no, how are you going to go about it? I don't nyambo a wochina doctor ba konso asisi no ho a ode ebre na Dr. Priscilla HD sabeti nka bi mu nwie kura osa ba bi ade shafo so abre as edition no ekoso no tina yed na se de ode ebre mu me nyina yen fa ni dwuma etimi aboaye eno achi no mesre se yen tuen saso mfre afoforo enye yen kwa de suen hia maye yen tuen san frɛ enamfo no ma even ko mo nya Adventist yen to mo san frɛ o mo no mestie adesua kunni se bi sɛ be ya o mo so no abrabɔ so be so miye even kwa bi kwa nam saa kwan yi so o ma ba fa so abaye akwanhwɛfo nti me nyina no yen nya ne saa na me di sɛ Nyankopɔn so be srai na yede adesua no na adesua no eba wie no ene be sɛ pastor nanka wasra na adesua no so nyina amaye na wasra abompaye ma Dr. Priscilla Owusu, the and our team in Adiciano is only new and also, and not a from my and so. The more woman now, more wedding in answer. Now, Mkosua, M1, now Muntimi, now Chi, Muntimi Moy, they say.
Okay. A jatum for Nedikan, that was first Ghana, Safu, Washira, say, a mofra. Ni youth ni yemma yibi wada uruma wa shira wo mo shira wo fo shira safima wo mo enyi ntitiye ne mpaebɔ ne nkyerɛkyerɛ a yɛde maa wɔn na wɔatumi asua adeɛ ne adom akyɛde a wode maa wɔn atumi asua adeɛ akɔduru mpɛmpɛn so a ɛne wɔn yɛ adɔktafoɔ mpanyinfoɔ a wɔn ɛrekyerɛkyerɛ yɛn gye yɛda wase bebree nye asɔre nyinaa ne nipa nyinaa na enya no sɛnea wɔyɛ First Ghana asafo yi na wɔn ani agye sɛ wɔn bɛdi nimdeɛ ne investment ne nea wofoɔ invest wɔn nyinaa wɔn bɛ pay back na wɔn akyerɛkyerɛ yɛn a yɛntua hwee ɛyɛ nhyira kɛseɛ gye a wɔn agye atum sɛ wɔn bɛ pay back to the church whatever we've given to them wɔn kyerɛkyerɛ yɛn ɛgya kɔ so ahyira wɔn ma yɛn na wɔtwe nyinaa yɛ de adɔktafoɔ nyinaa ɛhyɛ wɔn nsa started free Dr. Priscilla and numere odi adisua bre koso ama nimdeɛ ɔyɛ baatan ɔyɛ professional career ɔsan yɛ wife to a husband ɔsan ɛyɛ responsible on adwuma mu na this one no ɛso obefra sie na ngwadae yɛ to ɔmka agya na nso minim sɛ woka no ho nti obetumi ayɛ ne nyinaa ahyɛ odi anu yamti boa baawa na afei ɔne na busua nyinaa na adwuma soronko adoma kyɛdeɛ soronko a wode ahyɛ ne nsa no watoa so ayɛ ne saa na ɔtwi ɛgya problem biara yɛwɔ mmra yɛtie saa apɔmuden hyehyɛ solve ma yɛ yareɛ dadwene nkwadaa situations bi a agye yɛn nsɛm yɛnhu ne yɛbɛyɛ nkwadaa soɔden nkwadaa yareɛ atete egu yɛ so mpanyinfoɔ a yɛnti apɔ na ɔtwi yɛgya twɔ ne bɛhwɛ yɛn na sɛ yare na nam doctor afo yi so ma yɛ nimdeɛ because for lack of knowledge my people perish just so na otwi de mentias ye nim dia de bebo e bra na ere abo e pom den ho ba na say yade mfa yi na ase ma yeda wase yenwie na otwi no na ye di adanse se why adom bebre na ye pi nso e de my kra anadwi waye nyina ye ho ban hwe ye so bebi a ye wo se wadwumam se ye bededa se ye mpo ye tu kwan waye nyina ho ban de pachi na enwumredu na ye sa be hie mu a hwan ne yede ayiye na asema ebe kan ho yese wonkuto we Yesu Kristo din mu amen
amen pastor ida anse be kames pakra akono na me sa kai mo se dwumadi mu no eda ye kukira no all day prayer and fasting na nwumre no ye di mampaye ama yarefo mu wo mu pastor die mu aye sa dwuma no ama ye we talk about healing by faith ti di nyina no ye ntu ensan fra ofro enka mo yare mo chronic illness mo nyina no omomra na yentimi metia de sua ni yesa mo mpaye sa ma wo mo na nyankopon be sira ye pi na me nka ye ho o me and the partner dri on hwe enso na o me ya ho den ochina yentimi sa mfa nko enuma so yentimi sa mehyia mu biem bresi ya mu e wo na adom nti amen
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 miss pastor
identity mo wa hwe so amen
Amen.
Aaron Satan.